Well, thanks everyone who's made it here right on midday and taking the time out of their working day to join us for this Anne Rose webinar about working with the knowledge of experts by experience. My name is Lula Dembele and I will be your facilitator for the day with my lovely peers who are also lived experience experts and contribute to a range of activities across research and organisations that you'll get to hear about. Before we get into the content, I of course want to start by acknowledging the Turrbal and Jagera people, the Aboriginal custodians of the lands where I am today, and also acknowledge that we have people joining us from across many nations of the lands of many Aboriginal and Torres Strait Islander peoples. I acknowledge the traditional owners and custodians of all regions and pay my respects to elders past, present and emerging. And I recognise their continuing connection to country and their role in caring for and maintaining country over thousands of years, the longest living culture in the world, over 50, 60,000 years of heritage and knowledge and wisdom passed down. May their strength and wisdom be with us today. I also want to acknowledge the impact of family violence on individuals, families and communities, particularly Aboriginal and Torres Strait Islander women, and shine a light on the strength and resilience of children and adults who have and are still experiencing family violence. We pay our respects to those who did not survive and to their family and friends. So the reason we are here today is to explore and help implement the Australian National Research Agenda to end violence against women and children. This is the 23 to 2028 series of the ANRA, and it came about in 2022 after the federal government launched the national plan with the commitment to end violence against women and children in a single generation, an ambitious goal. The ANRA helps achieve this goal with ANROS developing the Australian National Research, or as I'm referring to it, the ANRA, which is a national framework that identifies what evidence is needed to end domestic, family and sexual violence, and importantly for today's discussion, how that evidence should be created. The ANRA was co-designed with victim survivors, researchers and practitioners and aims to help researchers, practitioners, people with lived experience, policymakers and funders ensure that their work is organised, purposeful and effective. The National Research Agenda identified 9 priority areas of research, which you should be able to see in the diagram on your screen. Importantly, these are areas where new evidence is sorely needed to help end domestic, family and sexual violence. The agenda also sets out the how of we do this work. It's not just the research we do, but it's just as important how we do it. The agenda asks us to reflect on the approaches to DFSV research and names 6 reflective prompts regarding ways of working and ways of knowing. And they are critically Indigenous methodologies, working with the knowledge of experts by experience, valuing practitioners' expertise, listening to children when they are children, creating space for pilots and evaluations of community-led interventions, and making better use of existing data. This webinar is the 4th instalment of this series and explores the 6 ways of working and ways of knowing. The previous 3 webinar recordings are available at the ANROS website, so if this is your first time and you want to catch up, they are there. And this webinar series is one way that we are supporting people in the research space and encouraging people to use the research agenda to guide research to end domestic, family and sexual violence in Australia. As I've mentioned, today's webinar is focused on working with the knowledge of experts by experience. The agenda highlights that people with lived experience of domestic, family and sexual violence have valuable expertise to contribute at all stages of the research process. Including them or us in research encourages a fairer distribution of power and a more nuanced understanding of domestic, family and sexual violence. My name is Lula Dembele. and I am going to introduce myself and then ask my peers here to introduce themselves as well, just thinking about and reflecting on our journey into research. I was one of the co-authors on this Australian National Research Agenda. And when I was asked to think about how I got into the research space, it started in two ways. One, like probably many of my peers and people with lived experience, I participated in evaluations of programs I had been involved in. For myself, I think the first one was Our Watch, one of their survivor advocate programs, the name of which has just escaped me, but people know it. And at the same time, I was also thinking about research gaps because I'm very passionate about shifting the narrative from understanding violence and domestic family and sexual violence, particularly as a women's issue, and understanding it from a policy paradigm as needing to end the perpetration of domestic family and sexual violence. So for myself, I had looked at the research and thought I was quite astounded that we didn't have national data on the perpetration of domestic family and sexual violence. So as a little person with lived experience, thinking that wasn't really good enough and that shaped the framing of where we invested and what we did, then I started the campaign to get a national research data set on the perpetration of domestic family violence. Bold, ambitious, didn't know what I was doing at the time, but there are many ways and pathways into this work. So I'm going to hand over to Nina, who I've had the privilege and pleasure of working with across a couple of projects in the years. Nina, how did you get into research?
Yeah, thanks, Lula. Hello, friends and folks online. I guess that I consider myself to be a long-standing researcher. I've done extensive research in the field, which is how I got my lived experience. So I've been involved with the justice system and had experiences of all sorts of violence, and also had an experience with alcohol and other drugs. And I consider that to be a field worker researcher. So I've been doing extensive research for many years. And then shifting that lived experience, field work, research into professionalism. I think like my first experience would have stemmed from being researched. So having participated in lots of research as a participant, which felt at a lot of the time exploitive and extractive. And like my story was being cherry picked to fit into particular narratives. And then from there, I think it's like just naturally really evolved really beautifully. So I then started co-producing, co-designing, co-authoring, doing evaluations. And now I found myself sitting on a number of different research projects as a research assistant. And that's just been really, really exciting. And also like lots of professional development has occurred and lots of skills. And I've got a deep understanding now of how research is done. And so I can also then support my community members to participate in research. So yeah, it hasn't been easy, but I won't spoil it because I'll save that for later. Thanks, Lila.
Thanks, Nina. Ashley, what's been your journey into research?
My journey started with like I'd mentioned previously to the panelists that I got into was kind of thrown into research after I got my first degree when I was like 38. So I was a bit late to the research space, but it also started. I did some work with Our Watch too, on the Aboriginal component of, I think it was called Change a Story, yeah. But my research came after the fact too, and I guess just like it was just said, that I was asked to be in research for quite a few non-Aboriginal women's PhDs. I forgot to mention this before, and just when I was thinking about the question, and so then it comes to the thing that Aboriginal women are the most research people, research people in Australia. And so I figured then, well, we need to start doing our own type of research. And so I teamed up with a few people, few women, non-Aboriginal women, to do some research, and that's kind of where I've gotten in the space now. And I think that it's extremely important for Aboriginal women's lived experience to be heard, and that because that is part of the research, isn't it? Is lived experience. Lived experience people are the researched. So it goes to show that we need to be more aware of that, and we need to what am I trying to say? You know, I'd like here, this is what I'm trying to say. Real change happens in research when survivors move from being spoken about to leading the conversation. So that's where I am at now in doing the research that I do, is stop talking about us, let us talk about ourselves and develop strategies and research that we know work for us. So yeah, that'll do it
Yes,
for me.
yeah, I mean, it comes back to that well-known phrase, isn't it? Nothing about us without us. And instead
Yeah.
of doing things for people or about people, doing it with people. And Anna,
It's
you've
also that
been,
thing that
yeah,
you listen to learn, you listen to learn and learn to listen. You know, so many people sit there and listen to Aboriginal women, but they're not really listening. In their minds, they're thinking, oh, this is what they need, this is what they need, or this is what they should do, and that becomes the research. Then they miss the full yarn and the full, you know, the essence of what it is Aboriginal women need, because, you know, unfortunately, you know, non-Aboriginal women seem to think that they know what's best for Aboriginal women, and that's been proven in the research.
yeah, good point to raise. And again, that who are you situating, who are you listening to, and who's got the power to make those decisions and choices.
Yeah.
I'm going to pass to Anna now, because Anna's done a lot of work working with other victim survivors and in those settings. So Anna, would you like to share your journey into this work?
Yeah, I'd love to. And I love what you were just saying there at the end, Ashley, about there's sort of an assumption that like people with lived experience can't be doing the research. Like we, you know, but we are, like the people in this call are. And when I say we, probably not me. Research is not something that I'm you know, it's not part of my main role, but I think sort of my journey into research, my first experience of research was with Anne Rose, and it was a few years ago now, around the same time that I co-founded the Survivor Hub, which is the charity that we run, that runs peer support groups for survivors of sexual violence. And I've had a lot of experience in being interviewed in research projects since then. And for me, the reason why I agree to them is because I love the idea that I can turn my lived experience into something that's positive and productive and that can actually change outcomes for other survivors. And so even though, you know, they often take a lot of time and there's a lot involved and frankly exhausting to be involved in research projects as a survivor, I still do it because I want to be able to, you know, change systems and institutions and outcomes for other survivors. They don't have to go through the things that we went through. And yeah, so I guess the biggest sort of research project that I've been involved in was an evaluation on the Survivor Hub. And I won't talk about it too much because this is just an introduction, but hopefully I have an opportunity to talk about it in the questions later on. Thanks.
Yeah, we'd love to hear about that experience. So we're just going to jump straight to the crunchy parts of this conversation because this is what keeps coming up time and time again whenever you're working in organisations or with institutions about how you engage people with lived experience. And there has been a history of studying people or creating that false barrier between those who holders of the research knowledge and expertise and those who are being studied, and also the different opinions and norms that are sort of set up into those institutions that continue to other others or keep them out or stop them from being able to share power and lead those conversations and lead that research. So straight into the barriers and challenges with my peers here today. And I'm going to start actually with you, Anna, thinking through what are some of the existing kind of institutional or organisational processes and practices that imbue those norms that have been barriers to participating that you've experienced?
I think there's two really significant ones. The first two things that I think of. The first one is payment. And so there's always issues with researchers on payment and talking about paying lived experience. We love to say that we pay people for their lived experience. You know, all of the people working with survivors and other people with lived experience like to say they pay people for their lived experience. But often that's, you know, $50, if you're lucky, $100 voucher to Coles or Woolworths. And while they say they have, you know, ethical reasons for that, and that's, you know, people not becoming reliant on research as, you know, a form of income, because then they may feel pressured to, you know, involve themselves in it because they need the money. You're providing people with a $50 voucher to a grocery store for them to relive their trauma in a way that benefits you as a researcher, because you get to say that you've, you know, engaged with survivors. But is it really authentic engagement if we're not paying people for their lived experience? And then part of that as well is, why is it that researchers are choosing where we can spend our money as well? So if it's a Coles or Woolworths voucher, that's deliberate, so people can't buy, you know, for example, alcohol or clothing or something with that. But, you know, who are we to decide where survivors want to spend their money, particularly when the reason why they're getting paid is for their lived experience? And the second big kind of barrier, I think, is how scared some researchers are, and probably more so ethics committees are, of people's lived experience. So to exclude people because they're survivors, but to be working on, you know, improving outcomes for survivors, but not actually listening to the people who have that lived experience, is, you know, that's not authentic engagement, and that doesn't actually improve systems and institutions and ways of doing things for survivors if we're not involving survivors. And on that, things like screening for you know, potential suicidality or self-harm and you know, other what they call risks, and then not allowing those people to engage in the research. We can't decide what people are ready and not ready for. All we can do is try and remove all of the barriers and trying to create safety and you know, really well support people to engage in research. And it's important because we get a lot out, you know, survivors and people with lived experience, we get a lot out of being involved in research. Like I was talking before about how you know, it allows me to turn something really horrible into something that's, you know, positive and productive. And stopping me from doing that is stopping my healing and recovery process, because it removes, you know, choice and agency and autonomy about engaging in research processes.
So well said, Anna. I'm just nodding along frantically with you. I'm going to pass to Nina, and just seeking some more sort of ways that institutions and organisations often think these are just standard practices. These are just things that we have to do in our processes to ensure we're doing the right thing. But often they create invisible barriers, or they may not even be thinking about who are they engaging in and what would that feel like to be on the other side of this process. So what's it been like for you to be involved in research? And are there any particular pieces that have come up for you with your lived experience?
Yeah, thanks, Lula, and thanks so much, Anna. I was also fiercely nodding along. Yeah, I can just like really relate to a lot of what you said, particularly around like, you know, starting my journey as a participant and receiving those vouchers. And even like, you know, back then it was that you had restrictions on it with like that you couldn't buy alcohol or cigarettes or dog food. And that also really triggered me, because it felt like I wasn't trusted enough to be able to have my own money and purchase it. Not that I would have, because I'm in recovery, but you know, that was really triggering for me, that it almost felt like I was discriminated against. But yeah, I think something that we come up consistently in our community, which is, you know, formerly incarcerated, criminalised, has been connected with the justice system, is the perception of being at risk, and that we are high risk because of the digital footprint that we carry around. And there's so many instances, I mean, you know, particularly in academia and research, where there is no risk to children, particularly if you might be engaging. I mean, you know, since COVID, so many things are online. So you're not even leaving the comfort of your own home. However, there are policies and procedures in place that restrict very, very talented folks, you know, with so much lived experience out there. And I'm going to take this saying from Mob. So, you know, it's all about that closing the gap. And I feel too that, like, you know, when we exclude people because of their history, we're actually not allowing people to move forward. And I think that, you know, when we're talking particularly around, you know, this whole webinar and series is around preventing violence. If we continue to place people in at a disposable level and discard their experiences and not allow them to engage in our society in positive ways where they can turn their pain into purpose, then we're actually restricting them and robbing them of leading, flourishing lives, which in turn creates our communities to be unsafer because folks don't have those opportunities. And I just want to echo to what Anna was saying. Like, I think I used this when we were chatting, that when people in professional positions look for jobs, they look at the salary packaging. And they sometimes might choose a job because it pays more or less. And so not allowing people to participate in research as a participant for only $50 an hour, it makes no sense. They should be valued. And the amount of time, because I'm now doing my own research project, so the amount of time it takes to make a phone call, get that participant to, you know, agree to whatever it might be, send them out the participation information consent form, read that through with them, then get them to come out to a face-to-face interview. They've got to catch public transport. You've spent hours and weeks sometimes organising for them to participate. And then you give them a $50 voucher. And it's just really, really heartbreaking. Yeah, so I think that that's definitely one thing, is the payment. And also echoing what Anna said, the other thing is the working with children's check and the restriction of those practices. I'm really fortunate that I have, I'm supported by organisations to participate. They'll do like a subcontracting sort of brokerage sort of arrangement, so then I can work with different universities. But yeah, I think it needs to be like, you know, we've shifted to those job applications where we do encourage people to apply even if they do have a record, and then it's up to the employer. And I would really like to see universities mimic something like that to support, you know, criminalised. And I think, you know, with misidentification on the rise, you're really excluding some victim survivors that have got really, really important stories to tell and to support the research, which, like, we know that, you know, research then become narratives and practice and gospels and frameworks. And so, you know, to exclude those experiences is just really harmful.
Yeah, it's just another way of not hearing from the people who are closest to the issues a lot of the time. And that doesn't get us anywhere. It just repeats old patterns. I just want to pick up on some of the chat I can see, and just acknowledging, you know, we're talking about payment and remuneration for expertise set, and making sure that the payment or the offering that is given shows and demonstrates value to what is being extracted essentially from someone for use in a different way. And we don't want that to be exploitative. And it's come up that sometimes payments can impact participant settlement, participant Centrelink entitlements, for example, and that is true, that does come up. But what we're talking about is really, when it gets to the crux of it, choice and value. And so it's not about saying the judgments that we've heard that have come through about, well, you can't use it to buy this and you can only use it for these things. That is inherently saying, we don't trust you to make good decisions about your life. We don't trust you to use your money well. And it continues to sort of situate victims as not making good decisions, blaming them and all that kind of thing. When what you're hearing is that people who come to this work often come to this work because they want to not have what happened to them happen to another person. And that's heard time and time and time again as the motivation as why so many people come to this work, whether it's lived experience, whether it's research, whether it's the DV sector. That's what a lot of us are doing. And so to situate an experience of victimization to put you as less than and not trustworthy is really problematic. And it again removes choice. And what do we know abuse and family violence is a lot about? It's about denying someone's choice. It's about controlling them and making decisions for them in a way that limits their freedoms, their options, their choices. So that's what it really comes down to, those principles. And we need to challenge them. Yeah, go.
Can I also add one thing, Lula? I think something that is really challenging for institutions or otherwise to engage with lived experience is where to find them. And so that's been because, you know, marginalized communities often move into the shadows because of the systemic harm, abuse and violence that they have experienced. So locating lived experience folks can be really challenging. We've sort of founded a collective called Fig Jam, formerly incarcerated girls Justice Advocates Melbourne. And so that's really supported people in Victoria to be able to locate folks who have been formerly incarcerated to be able to participate in research, because I think a lot of the time too, well, this has been my experience anyway, that so much of the work is relational. And so for me to be able to wholly give myself and share my experience has to be underpinned by trust. And I can only really do that once I have got a good relationship with somebody. So I think that, yeah, building relationships with networks and marginalized communities that are led by them and for them is sort of how you start to build those partnerships.
Yeah, absolutely. And again, that's challenging how we do the work, how we recruit or invite people to be part of that. And is it a transactional process or is it a relational one? And how do you take the time to really get to know people and not continue that imbalance and in and out groups of who is worthy and who isn't? And on challenging some of those barriers that reinforce power dynamics and imbalances, Ashley, how can we challenge them better, and what ways are working to improve victim survivor agency in research?
Well, I agree with everything that Nina and sorry, I can't see the other girl's name. Sorry,
Anna.
Kim and Anna. Sorry, said. But the reality is that one pathway won't fit all. You know, in a lot of this research, again, I come as an Aboriginal woman. We sit in the centre of, you know, all this research too, because we sit in the highest percentage of all things violent in this country. But we have to like shift back to the victim survivors, not just the researchers or the funders of the programs. Because when our victim survivors, regardless of race, are given agency, projects stop being something that is like being done to them or extracting information from them, and it reverts to them becoming something shaped with them, with their voices, with their experience. And when it's shaped by the very people that the research is meant to help, it's going to work better. And I think a lot of, you know, spaces that do this research miss that. But when I think about barriers, you know, it reinforces the power imbalance in projects again. So especially in the context of domestic and family violence, I see them as part of a bigger system that was never built for us as women in this anti-violence space. Because you look around the world today, look at what's happening in the world. All the leaders of every country in this world are saying that violence is the answer, right? They're all saying that violence is going to solve the problems. And clearly that's not it. And all the research that's done states that you know, that's not it. Yet the powers that be continually dictate this. And that's what I mean by we're in these places that the system that wasn't built for women that are experienced domestic and family violence. But to change these dynamics, I believe we need to centre lived experience, as we all do. Like the voices of victim survivors must not only be included but lead the conversations. It's about shifting the transactional to relational, like you were saying. That, you know, you just don't give a $50 voucher, you know, because that's tokenistic. Like the people that are there doing the research are getting paid. The people that are paying for the research are getting paid. So why aren't the people being researched getting paid appropriately? And you know, the barriers that are put in place with Centrelink payments and everything around that need to be changed too. That's an avenue that needs to be changed in order to get the correct information and the fairness. Like it's got to be fair. And right now, you know, that transactional stuff isn't really fair. So we also need to acknowledge and dismantle systemic racism. Services and projects have to confront what is racism. And I'll tell you this, for Aboriginal people, so this is where Aboriginal people sit different in everything racism. I'm just going off a little bit of topic here, because it's not the colour of the skin of Aboriginal people. And I'm going to tell a little story that's true. I went to a and no judgment either. I went to a plastic surgeon, right, to ask about, you know, my neck. I'm hating my neck at the moment. Not that I've had any plastic surgery, but anyway, I went, and it was all good and fine. And then he started asking me about health issues. And when I told him that I was, you know, Aboriginal, my mother has got all the health issues pertaining to an Aboriginal woman. His eye contact stopped. He didn't make eye contact with me anymore, and he turned around and said, "Oh, well, I would never have guessed that." So it wasn't the fact that I sit there looking like I am. It was the fact that I said that I'm an Aboriginal woman, and his whole demeanour changed. And that is what racism is in this country towards Aboriginal people. And that's been researched when Aboriginal people go into real estates, into hairdressers, into shops, into all those things. It's when they know that I could walk into a real estate and I'd probably get a house, but if I said I was an Aboriginal woman, I more than likely wouldn't. And that's the difference in racism in this country. And we need to incorporate that in all this research, because that's a missing link in it. So it's acknowledging those systems, the systemic racism that's in this country, and that's why I tell that story. And we also have to have flexibility in the way that we work. Not everyone's journey looks the same, and we've got to acknowledge that. You know, programs need to allow time, choice, and pathways that recognise trauma and resilience, rather than just forcing women into a one-size-fits-all. And that's what we do in this research stuff. We'll give you we'll give you a $50 voucher. Now bleed your trauma onto the pages so that we can write about it, you know? And we've got to stop, because then we don't think about, well, how are these women going to feel when they leave from the research, you know? And we've got to build accountability into the systems. That's what I mean by that. We have to be accountable for the women that we are researching. We have to have some accountability with how they're going to feel after the fact. And I don't think that's been done very well at the moment either. So they're the things that I believe we need to challenge to even out the dynamics.
And it's not the answer to thinking deeply about how people are going to feel once they've participated or once they've been involved in something. The answer to that is not, oh, well, we don't want to cause any distress, so we won't involve them.
Oh, call this number if you feel anything afterwards. No, we're not calling the number.
It's building that into the practice up front, building the relationships, building the trust.
Like that fly in, fly out. Stay around for a couple of days. So if the women do feel something, they know they've got a safe space to go. Don't just go in one day and out and you've got your information, you've got the recording, off you go. Don't do that.
And what's the feedback then as well afterwards as well, not only for that moment in time of the sharing, but then what's happening with what you've shared? Where is it going? How's it being used? How's it going to be represented? And I think that feedback element throughout a process is really an important piece of the practice in respect and caring for the making of meaning in what we've shared and what needs to be heard, because we see different priorities in what's gathered as well. So I think that's a critical piece. And that kind of leads us to what are the benefits of having lived experience, participate, and really what we're trying to talk about here is really sharing power and more leaning towards co-design. So I'm going to leave this open to anyone, but what's been the benefits of participating or doing more of the leadership, as you've been talking about, being led by lived experience or co-designing research? And that can be a benefit that's been personal, professional, or social. And I can see Anna just took herself off mute.
You're like,
maybe she was to
Anna's
jump in.
looking. There's a research project that I've been working on. I'm not very active in it at the moment because I also work full time as a social worker, so I don't have time for the things that I'd like to be doing as well as working. But there's a research project called Dignity by Design, and it's Sydney University is involved, Full Stop Australia is involved, there's a lot of people involved, and they employed me as what they called an expert by experience, and they called me a fellow researcher. And yes, I have a degree in social work, but I wouldn't have considered myself to be a researcher, but they called me one. And they paid me, and they involved me from very early on, and they've had survivors involved the entire time, and some of the researchers have lived experience and obviously speak openly about that, and what they did was they basically said to myself and a few other survivors, how should we do this? What should we do? What should we create? And we just had this massive brainstorm from the very early stages and said, okay, well, if we're creating resources, what are resources? What should they look like? What will people actually use? What will be helpful for the survivor community? And it was about kind of training people working in legal systems and also people working in AOD and mental health counselling about training them to work with survivors, obviously appropriately and safely work with survivors, and to have us involved really early on in those early stages and to say, what do you want this to look like as survivors who are invested in this because this is your lived experience? And I found that was a really good way to kind of engage us from early stages. And part of that as well was that when we invited survivors to do the focus groups, they invited me as well, and they said to the people who were invited, we talked about, we created sort of safety and we had group expectations and things like that in the beginning, and a lot of the participants who came said, we came because we knew Anna was coming, we know that she's a survivor, and we know that she'll ask us appropriate questions because she has that lived experience, and I think that makes a really huge difference for people engaging in lived experience. And it's an example that you can replicate with other people that you're working with, like actually having people come in with that lived experience and to be able to sort of create that safety and comfort, because there's something about being around other survivors where you don't need to explain the basics, and that you don't need to sort of defend yourself and things like that. And yeah, that's like what we created in that space. And I think, it's a good example of doing it well.
That building trust quickly and lessening some of those barriers to engagement, I think, is really critical. And I reflect on a project that Nina co-facilitated with me, where I was asked to work with women who have experiences of incarceration. And I was like, well, I've got the experience of domestic family violence, but I don't have that experience. So I really wanted to make sure we had the right experience in the room and the specificity. And it was just so valuable having Nina there on even small things about room setup and how people would feel and what that might mean to them, and how do we situate ourselves and how do we read and interpret people's body language. So that, for me as a designer in that space, knowing that was there and we were all benefiting from creating that opportunity for those women, for them to feel safe, was really valuable as the program owner, not just the person with lived experience. I might throw over to you, Nina, noting that we're a little bit behind schedule and we want to jump into the questions.
Yeah, sure. I mean, I firstly want to say a big thank you to every single person who has supported me to get here. Little moments of just allowing me to breathe, to very patiently sit with me and, work out how to use NVivo, which is a coding system for research. Other things like just holding my hand and opening doors for formerly incarcerated folks like yourself, Lula. That was such an amazing opportunity to be part of. I'm now also research assistant for a Anne Rose funded project. It's called We Keep Us Safe, and we're co-designing community-led responses to violence among people with a history of criminalisation and drug use. And being a peer research team. So the chief investigator has also got her own lived experience, and it has just been so heartwarming to be able to sit with folks and, you know, get their participation, to be in those interviews. And like you said, Anna, like the trust, because my experiences that I've had are similar to theirs, and we come from the same communities. So we instantly relate to one another. We understand each other. We can, like you said, Lula, like read that body language. It's just been a really, really safe space. And then going into co-designing workshops and those sorts of things, it's just been a really lovely process to be part of, but also to witness how research is structured from start to finish at every stage, and to be really involved in that. And yeah, just to like really, like the skills that I've gained from being a research assistant has just been so profound. And like I said before, like I'm now able to do my own research projects. I've got the skills to do that, and then to share that with my like members of my community, Fig Jam, and to be able to sort of run our own projects, and the tier, you know, the knowledge gets shared down. Like, you know, I mean, yeah, I think it's just such a good experience, because it really elevates people to be able to change the narratives, which is one of the things that I always find really challenging when I first started doing research and like citing all of these pre-existing ideas. And I'm like, how are we ever going to get anywhere into new age thinking when we're always citing all this old material that is really outdated?
It needs to be challenged. Just paying that forward is not what we want to do. Ashley, I'm going to throw to you last on any benefits that you've had personally, or for your organisation, or for the researchers that you work with.
I you know, we've done some really good research here. One recently with Jane Wangman, actually, that's coming out. We've created a podcast from it, and that's being launched on the 8th of October, actually, at the NCIE. But you know, it's all about improving the ways of working, and isn't just about service delivery. You know, a lot of people get caught up in the service delivery, even of research. It's about restoring dignity, control, and agency to the women that are involved in the research, so that they're not just, you know, surviving these systems that are put in place, but they're actively shaping them. That's where the real change comes. And that's what I reckon is the benefit of co-designing or participating in co-designing research. That's where it lies, in making it, you know, we're actively shaping the researchers that's been done by the research that's been done by the researchers, if that makes sense. Like, you know, just we can't, again, you can't just be in, get the information and leave. There's got to be a follow-on. There's got to be, you know, involvement all along the way in any kind of development of research. Because
there's no change in that.
Otherwise it's just tokenistic. And again, you know, we have to put more consideration into the women, and we're talking about women in this space, who are being researched, because very few people get through life without trauma. So anyone that's been traumatized by any form of violence, whatever, we all know that when you talk about, it's like anything, like if you've ever had a fight, you feel good if you've won it, but then, you know, 5 hours later you fall in a hump, feeling down, you know, depressed and whatever. That's the same with divulging your, you know, reliving your trauma and sharing it, because you're in these safe spaces and you're around other women that are talking about the same thing. So there's a safety net, and there's no shame, because everyone in the room is experiencing the same thing. But then it's when you step away and there you are on your own, that's when the trauma again hits. So we really have to be mindful of that. So in co-designing, if we do it properly, we have that follow-on effect. And again, then it becomes like, so you're not just surviving the systems, but you're actively shaping them by being a part of them and being followed through and seen to the end of it. That's where the change happens.
I'm loving that. And I think that's a, really important piece for each one of us to remember wherever we sit at different times in our positionality within institutions or within projects. How are we doing those pieces of change? What opportunities do we have to challenge it? Or are we just doing what's already been written down by rote and doing the same thing and repeating it and expecting that doing the same thing is going to create change, because it's not. So yeah, that's something I'd like to plant in everyone's brains. What can you do differently? Because that's what we're asking of all the people listening.
Yeah, so Lula, that's even what's left out in these ethics, that what you've got to get through the university to do the research. In those big long ethics forms that every researcher has to fill out before they get approval to do it. There's not enough about the caretaking of the researched people, the people being researched.
Yeah. Yeah, it's mostly still focused on limiting distress or risk to the institution.
Yeah.
So
yeah, that's what I think is really interesting. Like, the risk is always to the institution or to the organization. It's not about the folks that are participating. And we're still seen as, highly vulnerable, and that makes us high risk because we, something might go astray. But I think that we really need to be supported with agency. And when I think about transformative justice, like, it's about scooping up those voices that very rarely get heard and platforming those experiences and giving them a place and a space to be able to be heard, because that's how we hold systems to account.
Yeah. Yes.
You don't keep people safe when you treat them as risks. Like things like, somebody expresses thoughts of suicide and self-harm or something, you call an ambulance, or you call them, in the worst case, the cops or something like that. Who has that ever helped? Like, that is never going to be a helpful response, right? And that's because it's so risk and fear-based. That's what people end up doing, because they're basically just covering their own liability instead of authentic support of survivors, people with lived experience in their experiences of mental distress or whatever it may be.
Excellent. Thank you. Now, that has limited our time for some of the Q&A down to 6 minutes, but I thought what you were raising there was covering off on a few of the questions that we'd already received prior to this, which was about, like, what are those key principles and practices? And I heard agency, choice, trust, not treating people as a risk, and also, like, some of those ethical issues. Well, who are we caring for? When are we caring for them? What does that look like to work with more equal power? And I just want to reflect that piece of, like, it's about time, choice, and pathways, and that not everyone's the same. So being flexible and adaptive in your approaches to who you're working with is really, really critical. Ashley, I know you were wanting to talk about a bit, like, what strategies help you work with organisations that you personally might already distrust, and how, like, particularly historically and currently, with their role in oppressing Aboriginal people?
Well, when working with organisations that I may personally, I say personally, distrust, as the CEO of the only 100% run by and for Aboriginal Women's Centre in metropolitan Sydney, I have to always remember that I've got to go back to my values and to culture first and foremost. I remind myself who I'm accountable to, and that's my community. That's the women that use the service. That's my elders and the women who came before me and the generations that'll come after. So I have to take all that into consideration when I'm sitting at these tables that all working with these organisations that I don't particularly like. Like, we got some good DV funding for the very first time, and I said to the actual, the woman that was sitting across from me, negotiating it, I said, I don't know whether to be joyful or feel, am I signing a contract with the devil? Because we'd never had money for DV work here, so we had autonomy over how we worked without, with philanthropic money or donations that come through. And so it comes down to really setting boundaries, and I'm upfront about what I will and won't accept with these organisations, and I make sure that the lines are clear. I don't compromise on cultural safety or respect for our women. I will not. Being strategic and not personal, that's something I've had to really work on. So I don't have to trust an institution that to hold them into account or to push for outcomes that benefit my community. I don't have to do that. And we always we get scared of these organizations that sit here with the big money and whatnot, and that we have to say yes to everything that they bring forth. We don't. We can adapt it to how we want it. That's something that I've worked on. And I've also naming the truth. You know, again, in that same meeting, I said, I'm so sick of, you know, continually, and I said this earlier, bleeding our trauma onto the pages of these submissions for the white gaze. And unfortunately, all these submissions are seen through a middle-class white lens, and they do not see Aboriginal women. We are continually bleeding our trauma onto the page of these submissions and getting nothing. I don't want to do that anymore. You know, and then we got funding after that. So you know, you have to go in and speak truth and not just tick the boxes to get the money, because otherwise you're signing up the stuff that isn't going to work for an organisation like the one that I head up. And finding allies within, like, you know, we all need allies, regard, you know, black, what is it, red, black and brindle brown, whatever colour, nationality, whoever. If women, other people are out there that want to help and strengthen the, you know, the capacity and the lives of Aboriginal women, then I'm all for it. And keeping community at the centre. I've always got to remember that if I know I'm walking into a space that carries distrust, I walk in knowing that I've got my community to back me. And that is so important in these spaces. Because if you forget who you're advocating for, then you shouldn't be doing the work. And so I'm always reminded and walk in knowing I'm advocating for the women that come through the service, that some of the most disadvantaged women in this country. And I keep that front and centre whenever I sit at these tables and with any of the work that I do. And I think that is that's proven to how Mudgee has developed and the programs that we're running out and the women that we're helping is staying true to that.
Who you're doing it with.
Yes. Who I'm doing it for.
Yeah. I guess we're almost at time, and there's one question that's come up that I think is possibly relevant for everyone. And I was wondering if I could just get a very quick instant response from you on, you know, we're all sitting here, we've all got lived experience, we've all played different roles, wear different hats in different projects. And there's a question that came through about how do we manage that, having our own lived experience with balancing, creating space and not centering our individual lived experience into that dynamic. And I think that's what you were just saying, Ashley, a bit of remembering your role and the time, who you're advocating for and what you're doing. So if everyone could just give us their first gut instinct or the first trick that they go to for wearing those different hats and creating that space as someone with lived experience.
Do you want me to go first? I've got a one-liner. I always think of the Ashley that was running around after a man who was addicted to drugs when I was addicted to him. I focus when I'm doing these things, what would have helped her then? Not the Ashley that's sitting here now that's come through it all, but what would have helped me back then.
That's beautiful. I'm going to take that with me too. Nina.
I think something that I do is I just really recognize that everybody is an individual. And so my experience is my own and theirs is their own. And so even though that I might have particular values or a belief system that supports a safety or a narrative or a way of practicing in my life, that doesn't necessarily work for everybody and it doesn't align with everybody. So I just have to really remember that everybody is an individual. And I think that, you know, when we talk about that person-centered sort of approach, like, you know, I think that that's the beauty in research, is that there are so many different experiences. And that's been a little bit challenging too for me now, doing my own research project and framing it around community safety and how we as community members keep ourselves safe without our justice system. However, some of the folks that we've interviewed had very positive experiences. And so you have to hold that as well and, you know, work out why it was that they had those positive experiences. But yeah, just remembering that everybody is an individual, and our, you know, the way our mainstream systems operate don't support marginalized community. They support a very small minority of people in this country.
Thank you, Nina. And Anna, last word.
I've got an acronym that I learned from Mark Richards, who's a DV Alert facilitator trainer, and it's WAIT. Why am I talking? And I use it when I'm facilitating a peer support group, and obviously have lived experience, but I want other people to have the chance. I use it when I'm a social worker and I'm working with families. I use it basically, you know, all of the time. I'm always thinking, why am I talking? And I think it's, you know, really about creating space for people to share their lived experience.
Thank you. That was awesome. And so easy for us to remember, you know, who are we doing it for? Where did we come from? And what did we need at the time when we most needed help? Everyone's individual, and our systems treat us like we're cookie cutters, copies, and that not everything works for everyone. There is no one size fits all. So we're working with individuals and make space for that. And then wait, why am I talking? And asking, you know, who needs to be heard from? So I'm just going to come to the end of this session now and say thank you to the wonderful panelists and my peers in this work. You've really highlighted that what we need to change and think about is that time, choice and pathways. If you're treating people as a risk, you are not keeping them safe. There are genuine benefits to doing this work with lived experience, not for people who are this other group, but with lived experience. It allows us to build trust, to get more genuine outcomes. And I just come back to that piece that you were saying, Ashley, about we need to do work that is shaping the systems so we're not just surviving them. And that's the true benefit if we get this right. It's an emancipatory piece of work. So thank you for all of your reflections.